Let's be honest, we've all had a cut at some point, but have you ever really stopped to think about what's going on when you get stitches? That little piece of thread, it actually connects us to 5,000 years of medical history and some seriously advanced material science. So today, let's unpack the incredible story behind healing a simple wound.
So you get a cut, and a doctor uses a simple thread to help you heal. How does that even work? Well, in the next few minutes, we're going to dive into what a wound actually is, take a look at the body's amazing natural repair system, and see how that humble stitch has become a true high-tech surgical tool.
Okay, so before we can even talk about the solution, we got to understand the problem, right? So what is a wound? Turns out it's a lot more than just a simple cut. Doctors have very specific ways of classifying them because the type of injury completely changes how you need to treat it.
At its most basic, a wound is just any break in our body's protective barrier. You can think of it as the starting gun that signals your body to launch this whole complex repair sequence. But as you're about to see, not all breaks are created equal.
First up, the incision. Think of a surgeon's scalpel. This is a clean, intentional cut. The edges are super smooth and they line up almost perfectly, which, as we'll find out, makes it the easiest kind of wound for a doctor to close up nice and neat.
Now, a laceration. That's a whole different story. It's messy. This is a tear, usually caused by some kind of blunt force trauma, and it leaves these jagged, uneven edges. That makes it way more challenging to bring all that tissue back together perfectly.
And then, of course, there's the classic scraped knee. You know what I'm talking about. Well, technically, that's called an abrasion. It's where the top layers of your skin are literally scraped or worn away. It's usually not very deep, but it can cover a pretty wide area.
And finally, we've got the puncture wound. And this one can be really deceptive. It might look like just a tiny hole on the surface, but the injury itself is deep and narrow. The real danger here isn't the size of the opening, but the risk of trapping nasty bacteria and infection deep down inside the tissue.
Okay, so you've got one of these wounds. What happens next? Well, your body immediately kicks into gear, but how it gets to work really depends on the situation. Let's look at the 3 main strategies your body uses to get you healed up.
Now, the holy grail, the one doctors are almost always aiming for, is path number 1, primary intention. That's where you use stitches to bring those clean edges together so the wound heals fast with minimal scarring. If a wound has to be left open, it heals by secondary intention. It fills in from the bottom up, which is slower and leaves a much bigger scar. And then there's tertiary intention, which is basically a planned delay in closing the wound, usually because there's a big risk of infection that needs to be dealt with first.
So what's the #1 tool doctors use to get that perfect primary intention healing? It's the humble suture. It might just look like a piece of thread, but its history, well, it's pretty much as long as the history of medicine itself.
You see, a suture does way more than just close a cut. Its main job is to approximate the tissues, which is just a fancy way of saying it holds them right up against each other so the body can start its repair work. They're also used to tie off bleeding vessels, a critical process called ligation.
I mean, we've been working on this for 5,000 years. We're talking ancient Egyptians using animal intestines, ancient Indians using cotton. But then 2 innovations happened that changed everything. In the late 1800s, Joseph Lister started sterilizing sutures, which drastically cut down on deadly infections. Then, in the 1960s, we got the real game changer, the first sutures that could actually safely dissolve right inside the body.
So all of that incredible history brings us to today, where a suture is, well, it's anything but a simple thread. It's a seriously high-tech, highly engineered medical device with all kinds of different designs for very specific jobs.
So, the first big difference is how they're built. You have monofilament, which is basically like a single strand of fishing line. It's super smooth, glides through tissue with hardly any friction, and it's tough for bacteria to grab onto. Then you have multifilament, which is more like a tiny braided rope. It's stronger, way more flexible, and it holds a knot like you wouldn't believe.
The next huge choice for a surgeon is, should the suture disappear or should it stick around? Absorbable sutures are designed to be broken down by the body over time through hydrolysis. And really, that's just a gentle reaction with the water that's already in your tissues. They're perfect for closing up internal layers you can't get back to later. Non-absorbable ones are made of permanent materials like nylon or silk, and they're used when you need that strength long-term or just on the skin where they can be easily removed later.
Let's see how this all plays out in a real operating room. For some general internal stuff, a surgeon might grab Vicryl. It's braided for strength, but it's also absorbable so it'll disappear on its own.
For repairing a critical blood vessel or closing skin, they'd probably want Prolene, a super smooth, permanent monofilament. And if getting a rock-solid knot is the absolute most important thing, they might still go with silk, a classic braided material that surgeons love for how well it handles.
So, you've got all these options: monofilament, multifilament, absorbable, non-absorbable. How in the world does a surgeon pick the right one? Well, it's this amazing mix of science, a ton of experience, and, honestly, a little bit of art.
A surgeon has to juggle all of these things in their head at once. They're thinking, okay, is this wound on a knee that's going to be bending all the time? What's the infection risk here? Am I stitching delicate organ tissue or tough skin? How important is the cosmetic result? Every single scenario demands a different tool for the job. It's a fascinating puzzle that surgeons are solving every single day.
So, when you think about it, we've gone from using animal guts to these incredible sterile, self-dissolving polymers. The suture has had one heck of a journey. And it really makes you wonder, with all the new advancements in medical glues, laser welding, and even regenerative medicine, what will the next chapter be in this 5,000-year-old story of healing?